left here. Any final thoughts as far as the devices, the scaffolds for treatment of the, this CLTI patient below the knee? I mean, what do you think? Where do you think it's going? You think we're gonna have some new devices? You guys are able to use the MicroStent over in Germany. Have you seen it? And we've just talked about it. Have you seen it help you as far as these wound healing and these folks that have had this horrible disease?
Yeah, actually, we use the MicroMedical stent quite frequently, and so especially with the very distal implantation, a super improvement patient with wounds. We saw a faster wound healing, and we had very good experience also to bring this stent into the pedal arch.
Wow.
So yeah,
wow.
And what I also learned from these multiple MicroMedical stent implantations was, of course, some of these stents go down. It's clear, it's natural, but it's much more easier to reopen these scaffolds than other scaffolds which are used in the past.
Yep.
And here I see a clear advantage. As we just discussed, these patients are on a career and they come back. So this gives option.
Yeah, I agree, and especially the distal posterior tip, the elongation.
Yeah.
And quite often we need to be quite aggressive to cross there.
Yeah.
Then we need a scaffold.
Yeah.
We cannot do anything except a MicroStent.
Yeah.
I have a few patients that really responded well to this.
I've heard that it's quite easy to get through it, and it's quite easy to open it up and continue the flow if necessary. I know we don't really have the ability to have as much usage as they've had in Europe, but it's quite nice to see that. Any other final thoughts?
No, I'm interested in seeing the final results of some of these stent and scaffold trials. I think at TCT we're going to hear about the Life BTK data. So I believe that, again, as I said before, we have to do something different than what we're doing. Even though we're getting better at what we're doing, we still haven't quite got to the results that we want.
Okay, I'd like to thank my panelists here for presenting some talks today and for this enlightening discussion. Really appreciate you being here, and thank you so much for joining us.